Hello and welcome to the first lecture by myself, Ryan Moe, and I am one of the doctors at Mosaic Recovery with Dr. Kilgore, and what I hope to do with these lecture series is to talk to you about certain topics I think would be relevant to you as possibly my client or Dr. Kilgore's client about recovery issues and things that you may be dealing with in your life. So again, thanks for spending some time with me and going through this lecture, and we'll go ahead and get started. Okay, so lecture one, I wanted to talk about a topic that I think that there is some misunderstanding. Some people may have different opinions about what we're meaning when we talk about recovery or abstinence. So I put it up here, recovery versus abstinence, and I wanted to share with you some of my thoughts about what really recovery is, what abstinence is, and hopefully this will then start to have hopefully some thought generation for yourself as to where you put yourself in this kind of debate. So basically, my contention is that recovery and abstinence are two separate things. Of course, abstinence is a very vital part of recovery, but it is not recovery in and of itself. So what do I mean by that? So when I'm talking about abstinence, what I typically mean by that is that somebody isn't using drugs. Somebody is refraining from the use of drugs. And quite honestly, that is an important part of recovery, but that is just one act, if you would say, of recovery, not using drugs or other substances, alcohol, or any type of thing that may be chemically dependent upon. Somebody may be dependent on benzodiazepines, alcohol, opiates, all those different drugs out there. And they may think, hey, you know what, I'm not using them, so I'm in recovery. Well, no, that's pretty much what you're describing. If you're telling yourself, hey, because I don't use a substance, I'm in recovery, well, I wouldn't agree. I would say that, yeah, you're abstinent from that. You've chose not to use it, but you're really not living a life of recovery yet. And so what does recovery then mean? Well, recovery, in my opinion, is a whole life process. It envelops your whole life, the way you live your life, and quite honestly, the purpose of your life. A good definition of recovery would be a purposeful act of changing yourself in a positive way. So if you were to think of how do I do that, there are four different areas of a person's life that seem to be focused on someone who really is living a life of recovery. The first area would be home. So if you're really living a life of recovery, then home would be a safe place, a secure place where you can go, and there's no drugs involved or anything like that, and so you're at a home where drugs are not a part of it, and it's a safe, secure place for you to be. So that's one part of a recovery life. The second part of a recovery life would be health. So you have certain types of health. One would be physical health, another might be your emotional health, and the other, of course, me being a psychiatrist, would be mental health. So part of a recovery life is making sure that you're taking care of or paying attention to those certain areas of your health, so that you're doing the right things, you're eating the right things, going to see your doctor. If you're having depression or anxiety or things like that, that you're also consulting with a physician or other counselor or mental health treatment provider, and you're paying attention to your health status. Another part of life, of a recovery life, so the first one that I mentioned would be home, health, and then the third would be purpose. Purpose basically means that you're doing things, you're doing activities that are meaningful to you, and hopefully that you have those types of things incorporated into your life, and people that are in recovery typically are trying to live a life that has more purpose than what they were living in the past when they were using. So that's the third area, and then the last area would be community. So community meaning you have some supports outside of the home that you've provided for yourself, that safe, secure place, but outside of that, in the community, you have supports and help as far as with other people, other relationships, other friends, other organizations that you're involved with that can help you. Just me talking to you off the cuff a little bit. What we find, Dr. Kilgore and I have had conversations with people who have come in to get treated. Of course, a lot of times they're searching for something to take their pain away quickly, and we have been able to provide Suboxone typically for those people who are in withdrawal or have been living a life where they are pretty miserable, quite honestly. When they usually come to see me, they're at a point where life has become unmanageable and they want something different for themselves. And they come in and they talk to us and give us a little bit of history. We're able to then decide if we need to treat them or not, and 99% of the time we do decide to treat an individual that's having problems with addiction. But what we have found is that people, you know, a lot of times will try to take the easiest road possible. Meaning what I've seen and what Dr. Kilgore has seen is that people come in, they get on Suboxone, they feel quickly better within a day or two, and after they get on a stable dose and their withdrawal's gone and they're not, you know, spending all their money and all their time chasing drugs out on the street, they feel like, hey, you know, I've accomplished what I've wanted to accomplish. I'm in recovery. Well, I would say that at least the physical part has been made easier for you. You're not experiencing the pain you used to experience because you're taking a medication that helps you avoid that. However, it doesn't really mean that you're in a recovery program or living a life of recovery. It just means you don't feel bad. It means that, hey, I don't feel bad, I feel kind of like my normal self. And so typically what I would see is that people go about their life and live their life without really paying a lot of attention or consideration to what got them to come to see me in the first place, which is an addiction. And as you know, I mean, I have to make a diagnosis of an addiction based on some of the things that my patients tell me. Like, you know, a typical story would be, yeah, Dr. Mo, I started using years ago. I started out because I was given pain medicines for some kind of pain condition. The opiates seemed to agree with me, gave me energy, gave me focus. I felt so much better on them, but then not long after that, after I started using them more and more, it became a problem. I started running out of my medicines. I started to have to look for them in other places. I started spending a lot of my money, and my life became unmanageable. I was pretty much, all my energy was focused on getting medicines or getting heroin or what have you, whatever you were using off the street, and you were living a pretty miserable life. So that's the typical story that somebody like myself would hear when somebody comes in seeking treatment. And the problem, one of the great things about Suboxone, at least, is that it really does work well. You start somebody on Suboxone. Methadone is another example of a medicine that I have used at the narcotics treatment program to treat people with opiate addiction, and you put them on these medicines and pretty quickly the withdrawal goes away. But the problem with that is that once that pain leaves, a lot of people don't really want to continue working a recovery program. They're like, I'm good, I'm fine, I really don't need anything else. Well, that's not really the whole point of somebody being treated. That is an important piece of it, but it's not the only piece of it. I'm the medical director of the narcotics treatment program, And through that service, we have a lot of different groups. We have counselors, we have nurses on staff. And what we're hoping when people come into that treatment program is that they really get involved in a program, meaning they go to groups, they are talking to their counselors about things that have happened to them in the past, how they want to change, how they want to make their lives better. And that really takes work, and it takes work every day. And that's what I'm talking about when I'm talking about a recovery program, is that people become very mindful of the things they need to do to change themselves. So that is what Dr. Kilgore and I would hope for our patients, is that you're doing things that are really helping you change to become a better person. So when you are doing a recovery program, the first thing you have to understand is that you can't do a recovery program by yourself, meaning isolating yourself or not talking about your issues or not going to meetings or having any other supports in your life where you're actually working on yourself is best done with the help of other people. As a matter of fact, one of the biggest retractors or poisons, I would say, for a recovery program is for somebody to isolate themselves. So the more you isolate yourself, the less likely you are to be in recovery, and the more that you share your feelings and your thoughts and are interacting with other people, the more likely you are working in better recovery program. And that's one of the reasons why so many people outside of the treatment community are evaluating and actually making some fairly critical comments about people that are on methadone or Suboxone, is what are they doing as far as their recovery besides just taking a medicine. And that's a question I would like to pose to you. If you're finding yourself as a person who only takes a medicine and that's all you've done for your recovery, then I would hope that you evaluate that and maybe talk to your provider about that and see what other things could be added to really enhance your recovery program. Because nobody really wants to just be static and just kind of go through life without making any positive changes, and that's the whole purpose of a recovery program, is to make positive changes in your life. So my challenge for you would be to really think about that for yourself. Talk to Dr. Kilgore or myself about where do you think you are in a recovery program. If that's something that's important to you, that's something that you've worked on and are working at, because it's a everyday kind of issue. You don't take a day off of recovery, you work at it every day. People who are in recovery will say, you know, yeah, this is something that I do every day. I work at it every day of my life. They go to groups, they go to meetings, they have supports, they're doing the things that they find are helpful to them so that they can live a better and more fulfilling life. There are a lot of people, and even myself included, which would contend that addiction is a spiritual problem. A lot of people think it's a chemical problem, and it is a chemical problem, but at a deeper level, it's a spiritual issue. And so there is no chemical solution to a spiritual problem. And what I mean by that is I can make your physical pain probably go away with the medicine that I prescribe you, Suboxone, methadone, what have you. But what's left is really a truly deeper issue at hand. It's a spiritual issue. A lot of people would say that the key to long-term recovery is a spiritual issue, meaning, you know, we can get into a definition of what spirituality is, but what I would say it is for people is a personal growth, a personal reflection on who you are and how you want to be different and be a different person. And I want you to also understand that you have to try and do something today that you're going to be happy about tomorrow. That's probably what people in recovery will focus on, is what can I do today that actually will have some impact for me in the future. Because quite honestly, a lot of the people that I have seen and would talk to have lived a life where we're looking for immediate gratification. What can I do today that will make me feel better today? Feel better this second. And people in recovery actually start looking at life a little bit differently and are trying to figure out, what can I do today that may have the best impact for me in the future? And if you can ask yourself that question and really be honest with yourself about what those things might be, I think that you'll start maybe heading down a path of recovery that takes you places and changes you into a person that maybe you thought you could never be. So that's our goal, that's our hope for all of the people that we treat, is that it's not just something that we're giving you a medicine for, but it's actually something that we're in a journey with you, our clients, to see where you can go and how much of a better person that you can become. But that all starts with you being in a recovery program. So best wishes to you, and thanks for listening.